Hi everybody, Sonia Rollins for Chamber Spotlight. Today we are at AFC Urgent Care at 90 Middlesex Turnpike in Burlington. They are celebrating 5 years in the community, and we are thrilled to come in, get a back look at some of the ins and outs that goes on within this great clinic that people have come to know as a place to go for so many different varieties of healthcare reasons. Join me inside. We're really excited because for Chamber Spotlight today we're going to be able to take a tour of inside AFC, although I assure you many people have probably already come in here for the great service. So ladies, if you'll introduce yourself for me, please.
My name is Shannon Connolly, and I am the Business Development Manager for AFC Urgent Care.
Great.
Hi, my name is Lindsay Curlow, and I am the Regional Practice Manager for AFC Urgent Care.
Awesome. Lindsay and Shannon are going to take us through. They're going to show us. We're going to talk to a few people here. And Chamber Spotlight today is all about quick and good service in the healthcare industry. People are coming in, of course, and they're seated. This is your waiting area. Yes.
So you come in as a patient. You can see our beautiful, well-lit, nice and clean waiting area with magazines that are not super old as you typically see in a doctor's office.
Exactly.
Quick registration process up front. And then it's your turn to wait. We have coffee, tea, water. All obviously free for patients while they wait.
Your wait time is not a long wait time. On a good day, the promise is you're in and out, if you can, inside within an hour's time.
About an hour,
right?
Yep. So our typical wait time is about 10 minutes.
Right, which is fantastic. And then for those of us, like myself, who sometimes get a little antsy and think, I wonder how close I am, you also have the screen, which kind of tells people where they are in the queue. Out here. All right, we're going inside. So you know what I think is really interesting is I think when people come into something like AFC, they don't envision that there's a lab or there's x-ray or anything like that in here. So in the back, there is all of that. So people can actually come here, get lab work done, and get their x-ray done if they think.
Exactly. So we can do a lot more than most people think. It's our in-house lab. We do all types of rapid testing, things that patients want answers to immediately. So strep, flu, mono, we do a rapid HIV and a rapid Hep C test in this lab as well. Order x-rays during all hours that we're open. We don't have special x-ray hours or anything like that, so every day 8 to 8. If you need a chest x-ray, we can definitely order an x-ray for you right here.
All right, so how many exam rooms are there at AFC?
So we have 9 exam rooms in this location and just over 3,000 square feet.
Okay, great. And in an exam room, obviously, the patient comes in. We all know what happens in here, right? But you have all of them are set up similarly? I mean, when you're put into a room, are they put in for certain reasons?
Nope. So every room that we have in our facility is exactly the same. It keeps us really efficient. Our staff doesn't have to worry about what room they're in, where the supplies that they need are. Every room is set up and organized exactly the same.
We are here with Dr. Oreo. Dr. Oreo, if you could tell us your title for AFC.
My name is Christina Oreo, and I'm the medical director for AFC Urgent Care in 6 locations.
Your history as a physician, you obviously were a physician before. Where were you before you came to AFC?
So I'm trained in emergency medicine. I'm board certified in that specialty, and I've worked in many community settings, community hospitals, most recently at South Shore Hospital before coming here. And then prior to that, I was in the military, so I was an Air Force emergency medicine physician for many years.
Sometimes people have different thoughts about urgent care. When is it urgent care, and when should they be calling their doctor? Can you kind of touch on that, like what you've seen the evolution over time with AFC in general, or just the urgent care in general, and then where AFC fits into that picture?
Sure. So here at AFC Urgent Care, we see all non-life-threatening illness and injury, and we play a very important role in community medicine. So patients often make routine appointments to see their primary care physicians, and then sometimes have acute problems but can't get in to see their primary care physicians. And so we fit into that role, and then we're an intermediary between the emergency department and primary care. We treat a lot of the same things that can be seen in the emergency department at a fraction of the cost and in a much quicker manner, more efficient manner. So for example, a laceration. If somebody has a hand laceration or an extremity laceration, they might wait in the emergency department for 6 to 8 hours to be seen for that, relatively minor injury that we can see here and handle very effectively.
The other thing that I think is really great to tell the community is you can also do the physicals for sports, physicals for schools, things like that. That is something that people can come to at AFC, correct?
That's exactly right. So we do physicals all the time, particularly right before the school season starts and sports season starts. So we can do them for pediatric patients, and we can do them for adults who are doing physicals for routine employment or just their routine physical as well.
How have you seen the transition from going from an emergency room physician to coming to AFC?
So I've actually been doing this now for 6 years, 6 years actually today, since I've left the emergency department, and I've watched this transition in the community over the last 6 years. 6 years ago, nobody really knew what urgent care was, what we could do, what we could handle, and now we are a household name for many people, and many of the patients in the community really rely on us for both their routine and acute care. And so it's been fascinating for me to watch that transformation. And I think what people need to know is that we can really handle many, many medical conditions here. We can save you time, we can treat you effectively and efficiently for you and your whole family.
Yeah, and you know, if anybody has any questions about that, I would say you could call AFC and just ask the question before you get here, because you nailed it. I think people now are very much familiar with what AFC is, but in the beginning it was hard for them to decipher where that fits into the mix, and really it fits in every aspect of healthcare. Dr. Oreo, thank you very much for joining us. Take care. We're really excited to be here for Chamber Spotlight because I think everybody knows the name AFC. You know, it's certainly become a family name in town. Everyone knows what they can come here for, but it's nice to see the behind the scenes things. So, you know, a day in the life of Shannon. What do you do here when you're in the office?
So my title is Business Development Manager. Not a lot of people know what that means.
Yeah.
I'm kind of in charge of all of the community outreach. You might have seen me at like local events,
Yes.
Burlington Day. We sponsor quite a few 5Ks, the PMC Kids Ride in Burlington.
Right, which just happened. That went really well, I hear.
Yes, it was super well attended. We love to sponsor and support the communities that we operate in. Along with that, I'm also in charge of the occupational medicine visits here. That includes drug screening, breath alcohol testing, pre-employment physicals for companies that need to get their employees tested before they start work.
It's fantastic. And when we talk about community outreach, you guys really take that 110%. So some people talk about wanting to be involved in the community, wanting to do things. You kind of, the company as a whole, have kind of just hugged that whole philosophy, you know, and you've taken it on both on the chamber side and for just Burlington committees and things like that. Everywhere you turn, you see AFC, which speaks a lot to the corporate climate and speaks a lot to what the management team thinks about giving back to communities they live in, correct? Or they work in, I should say. So, okay, we have business development. We do a lot of the outreach. We talk about, you know, what happens with the companies. And then, Lindsay, there's the operations side of it, which is all day, every day, right? So talk a bit about that as well.
So my job is kind of just to make sure that the clinics are running smoothly. So to make sure that patients are having a good experience, that our staff is having a good experience. We love employing people from our communities. We love making sure that they have a nice place to work. And it's kind of my job to make sure that everything runs smoothly, to make sure that can happen. If patients ever have any concerns or issues or anything that they want to talk about, they have a face that they can come to. So they have a local person who they'll see at Burlington Day, they'll see at Truck Day, and then if they have a question or a problem, they can come to me. They know my name. A lot of patients have my email address and my number, and I encourage them to contact me directly. And I really think that's important, that patients know that we're not just a big corporation. We're a locally owned business who really has a lot of pride.
It's a great resource. If you were going to give somebody a message, just in general, about AFC, what would you say?
It's very convenient. We're always here for you. We're a locally owned and operated business, and come right in. We'd love to take care of you.
Perfect. Lindsay, you want to add?
Sure. I can just say that we have been here every day for the last 5 years, supporting the community, making sure that any ask of us, we've done our best to try to fulfill, and that we're an amazing community partner, and we're not just here for the benefit of what we can get. We want to give back. So
Perfect.
It's been a wonderful experience. We've treated over 100,000 patients in this location, and we're so proud to be able to do it. 100,000 patients with an average wait time of about 8 minutes, average door-to-door time of well under an hour, 48 minutes.
It's unbelievable. I've told you, I'm like a poster child for that. I would vouch for you 110% that you are in and out of here. It's actually quite amazing.
Thanks. We love to say that we hope we never have to see you, but if we do have to see you, we are by far the most affordable, efficient, and convenient option for healthcare in the market. We have board certified providers. We're here open every single day of the year, 8 a.m. to 8 p.m. And we've been open every single day for 5 years. We have not closed our doors, and we're thriving and we're growing, and we're really happy to be able to support the community of Burlington.
It speaks in volumes to you. Let's talk about your staff, because obviously your staff is fantastic and the work that they do here. So like you said, certified professionals who are doing their job in here. How many? You always have a doctor on staff from 8 to 8?
We always have a provider. It might be a physician assistant. It might be a nurse practitioner. Oftentimes it's a physician, a doctor.
Okay, great. And you're always, x-rays are always available, lab work is always available during your hours?
That's right. Lab and x-rays available. We're here. We treat high acuity, non-life-threatening conditions. And patients have been asking us in this community if we can be their healthcare home, if we can offer primary care, and we are rolling out primary care this fall. So we're really happy to introduce primary care services for the community of Burlington in the fall of 2019.
That's actually big news.
It's really big news.
Yeah.
It's really big news. We're also offering immigration physicals. A lot of the local companies have folks who are going through the immigration process, and we're here to provide those immigration physicals, and we're the only folks in Burlington who provide those immigration physicals.
That's amazing. Now, so you talk about primary care rolling out, which is huge, which leads me to the next question about insurance. So, tell people who are watching, insurance here, you accept all the major insurances. There is no discrepancy between going here or going to the hospital, for example.
Not just all the major insurances, we accept all insurances. We're contracted with 18 different plans. Even if you're out of network with an out-of-state plan, we will accept that insurance and work with that out-of-state insurance. We're contracted with Medicaid, with Mass Health, with Medicare, and then all of the private insurances.
So there is no reason someone couldn't come here to get a service done. They should not be worried about the insurance portion of it.
Not at all. Not at all. Also for occupational medicine or workers' comp, someone gets hurt on the job, we can process that here, treat them here, get them the care they need. Or if someone needs to be drug tested for a pre-employment physical before they can go get a job, we do occupational medicine services here too.
Give us your experience in Burlington. What's it been like? What have you seen over the last 5 years in the change of the Burlington climate?
First of all, Burlington has been amazing, and we work in towns all over the country. We work in a lot of towns here in the Boston market, and Burlington is a very special town. It's unique. It was very welcoming to us from the moment we opened our doors 5 years ago. The Chamber, the Burlington Area Chamber of Commerce, is so strong here that we've really gotten to be involved with the Chamber and with the community and supporting other businesses and supporting the members of the community through the Chamber. And we have been welcomed as a result, and I think we've been rewarded as a result of our commitment to the community. People see that. They come in our doors and say, hey, I saw you at the local truck show, or I saw you at the local the farmers market, and they want to help us, and we want to help them.
Your background says that service comes first, and talk a little bit about that.
Sure, and thank you for bringing that up. So I was a Marine officer for about a decade. Was really proud to serve our country. Our medical director, Dr. Oreo, was an Air Force officer also for about a decade. She was a battlefield trauma ER doctor. And together we believe in sense to service to something greater than oneself. So we give back a lot. We've built a lot of personal relationships in the Burlington community, and we're here to stay, and we love this place, and we're not going anywhere, and we're here to support the community.
I love it. So AFC, congratulations again. Dave Adams on 5 years in Burlington and on your 6 locations.
Thank you.
And continued success.
Thanks so much, Sonia.
Thank you. I'm so glad you had the opportunity to take a tour with me inside AFC Urgent Care today. Again, located at 90 Middlesex Turnpike in Burlington. They have been here open 8 to 8 every day for the past 5 years and doing a great service for the community. Make sure you feel free. As Dave Adams said, he hopes he never sees you, but if you need to come, they are here for you and doing a great job, both for the healthcare industry and for the community at large. For Chamber Spotlight, I'm Sonia Rollins.